Comprehensive Depression Management Guide for Healthcare Professionals. Understanding Depression, a Clinical Perspective. Welcome to our comprehensive guide on depression management tailored for healthcare professionals. Today, we'll delve into the intricacies of depression, its pathophysiology, evidence-based treatments, and practical strategies for clinical practice. Segment 1. Epidemiology and Pathophysiology. Let's start with the epidemiology and pathophysiology of depression. According to recent studies, depression affects approximately 5–10% of the global population, making it a significant public health concern. Neurobiological dysregulation, including alterations in neurotransmitters such as serotonin, dopamine, and norepinephrine, contributes to depressive symptoms. MCQ. What is the estimated prevalence of depression globally? A. 1–3%, B. 5–10%, C. 15–20%, D. 25–30%. Explanation: the correct answer is B. 5–10%. Depression affects approximately 5–10% of the global population, according to recent studies. Segment 2. Clinical presentation and diagnosis. Now let's discuss the clinical presentation and diagnosis of depression. Symptoms include persistent low mood, anhedonia, changes in appetite or sleep, psychomotor agitation or retardation, fatigue, and feelings of worthlessness or guilt. Diagnostic criteria, as outlined in the DSM-5, help guide the diagnosis of major depressive disorder. MCQ. Which of the following symptoms is not included in the DSM-5 diagnostic criteria for major depressive disorder? A. Persistent low mood. B. Anhedonia. C. Increased self-esteem. D. Changes in appetite or sleep. Explanation: the correct answer is C. Increased self-esteem. While feelings of worthlessness or excessive guilt are included in the diagnostic criteria, increased self-esteem is not typically characteristic of major depressive disorder. Segment 3. Treatment modalities. Treatment for depression often involves a multimodal approach, including pharmacotherapy, psychotherapy, and lifestyle interventions. Pharmacotherapy options include SSRIs, SNRIs, and TCAs, while psychotherapy modalities such as CBT and interpersonal therapy can provide valuable support. Lifestyle interventions such as regular exercise, balanced nutrition, and adequate sleep are also important aspects of depression management. MCQ. Which class of antidepressants is associated with a higher risk of serotonin syndrome when combined with monoamine oxidase inhibitors, MAOIs? A. Selective serotonin reuptake inhibitors, SSRIs. B. Tricyclic antidepressants, TCAs. C. Monoamine oxidase inhibitors, MAOIs. D. Atypical antidepressants. Explanation: the correct answer is A. Selective serotonin reuptake inhibitors, SSRIs. Combining SSRIs with MAOIs can lead to serotonin syndrome due to excessive serotonin accumulation in the brain. Segment 4. Prognosis and complications. Lastly, let's explore the prognosis and potential complications of depression. Recurrent episodes occur in approximately 50–60% of individuals with depression, highlighting the importance of long-term management and relapse prevention strategies. Complications may include comorbid anxiety disorders, substance use disorders, and suicidal ideation. MCQ. What percentage of individuals with depression are estimated to experience recurrent episodes? A. 20–30%, B. 40–50%, C. 50–60%, D. 70–80%. Explanation: the correct answer is C. 50–60%. Recurrence is common in depression, underscoring the importance of long-term management and relapse prevention strategies. Closing thoughts. Thank you for joining us on this educational journey through depression management. By understanding the epidemiology, pathophysiology, clinical presentation, treatment modalities, and prognosis of depression, healthcare professionals can provide optimal care for patients struggling with this debilitating condition.